The United States is drowning in opioid addiction. In the past 2 decades, 500,000 people have died of opioid overdoses in the United States. In fact, 191 people overdosed on opioids every single day in 2020. That's nearly 70,000 in a single year. Fueling this epidemic? An early wave of opioid transactions diverted from legitimate use, transactions that exploited chronic blind spots in the distribution supply chain. The result? Debilitating addiction, trillions in economic losses to our nation, senseless death. Left unchecked, what does it mean for our country, our loved ones? What if we could curb the ability to exploit these blind spots? What if emerging technologies could put a stop to these suspicious shipments? And how could government policy changes help law enforcement, public health, and industry professionals end this pain? These questions form the heart of the project between WashU Olin Business School and the Brookings Institution. Backed by the Bellwether Foundation, a dream team of policy experts and scholars tackles a major societal megatrend to formulate recommendations on business strategy and public policy. Our joint commission demonstrates strategies and builds state-of-the-art technology to combat opioid trafficking in collaboration with WashU Olin Center for Analytics and Business Insights, a real-time alert system that flags suspicious shipments, a system to better equip law enforcement, a system to identify trends. That goal is closer than ever. WashU data scientists have built that system. They've probed years of opioid transactions. They've cross-referenced the data with known bad shipments. And they've built an anomaly detection system capable of flagging suspicious opioid shipments in the future with 100% reliability. Indeed, it's a system that could answer recent court settlements that call for a data-driven, independent clearinghouse that can monitor shipments in real time. So, how could we put this system into action? That's our dream team's next task, identifying obstacles and recommending policy changes to modernize data reporting. Recommendations for real-time data sharing between law enforcement and industry, with the tools to detect patterns of diversion and flag suspicious activity. With these tools and these policy recommendations, we can guide the allocation of law enforcement resources. We can equip public health and pharmaceutical industry professionals in their united fight against the opioid crisis. In approaching this critical national issue, the Olin Brookings Commission seeks to combine the wealth of data, the power of modern technology, and the will of policymakers to create lasting solutions. Where business and government converge, where the academy and the public square come together, we find data-driven solutions. This is an opportunity for policymakers and business leaders to unite and support, to work together, to deploy modern analytical tools and help eradicate this affliction. Together, we can curb the drowning.
I'm really privileged to represent members of an extraordinary partnership that has produced this exciting work that we're here to present and to discuss today. As you saw in the video a moment ago, and as you'd have seen in the headlines, opioid abuse and misuse has plagued individuals, families, and communities for decades. And today, I'm really looking forward to revealing what I believe will be an extraordinary tool in the fight against this epidemic. I'm proud to share this work produced through a powerful partnership between Brookings and WashU Olin Business School. At Olin, we believe business leaders have the power to change the world for good. And with Brookings, we combine the academy, business leaders, and policymakers to drive solutions. So today, you'll see the results, the outcome of a year-long project from our first joint Olin Brookings Commission. And you'll see what is really state-of-the-art data science solutions combined with thoughtful policy analysis. The Commission teamed industry experts, law enforcement and medical professionals, and researchers. And that's a team assembled thanks to a generous grant from the Bellwether Foundation, for which we're grateful. The Bellwether Foundation is driven to improve quality of life by supporting innovative programs that really make a positive impact. And the project we're discussing today is the first of 3 Bellwether projects, or 3 Bellwether commissions that's been funded through our Olin Brookings partnership. And I want to acknowledge and thank the Bellwether Foundation's Ginger Smith, who saw the vision in our plan to tackle important societal issues through business insights and policy recommendations. Okay, so let's get on with it. I want to briefly introduce the key people behind the work, and you can learn more about them in the Olin Brookings Commission's full report, which will be available on the website referenced in the handout you've received, or through the link we're sharing right now in the virtual chat. So I'm going to ask each person to stand when I introduce them briefly. So Anthony Sardella is our Commission Chair. And Anthony is the founder of a data insight firm, Evolve24, as well as a valued faculty member at WashU Olin Business School. Dr. Anne-Marie Dale is a professor of medicine and occupational therapy at Washington University's School of Medicine. Van Ingram is executive director for the Kentucky Office of Drug Control. Gina Papush is the former Global Chief Data and Analytics Officer for Cigna's Evernorth. Darrell West is Vice President and Director for Governance Studies and a Senior Fellow for the Center for Technology Innovation at Brookings. And joining us remotely is the Honorable Mary Bono, a former US Congresswoman and Chair of the Community Anti-Drug Coalitions of America. I'd also like to introduce the individuals behind the research, representing Olin's state-of-the-art Center for Analytics and Business Insights. So in addition to Tony, our Commission Chair, who also works on the research, I'd like to introduce Sithu Sitharaman, who's the co-director of the Center and Olin's Patrick McGuinness Professor of Marketing. Michael Wall, the Center's co-director and a Professor of Practice in Marketing and Entrepreneurship at WashU Olin. Annie Shi, a Marketing PhD student at WashU. And Chenthuran Ubayakaran, a WashU graduate in Computer Science and a candidate to receive a Master of Science in Data Analytics and Statistics this year. So I'm deeply grateful for the time and commitment of all of these wonderful individuals and the support they've given to this project. And I can share with you that over the past year I've seen the gravity that these individuals have assigned to the work. I've seen the care they placed on every word at every stage, and their research, their conversations, their debates have focused on producing solutions designed to treat industry leaders, government regulators, substance abuse professionals and policymakers as partners. And thank you to all of you for your work on this project. Okay, and once again, thank you for everyone for being with us today. Now I'd like to invite Tony, Sithu and Michael to the stage for our formal presentation.
Thank you, Dean Taylor, and welcome all of you both here today with us and online as well. We're very excited to present the results of our research, as well as the findings and recommendations from the Commission for Policy Considerations to tackle this complex, multifaceted challenge that we have in our society. There's 3 significant reasons we undertook this effort. First, that society is still at risk from the diversion of opioids from legitimate pharmaceutical supply chains, causing these products to get into the wrong hands. We've seen the significant impact it's had on our society, but it's continuing every day. Despite significant efforts around litigation and many different programs to address this issue, the blind spot still exists. The blind spot in regards to being able to detect if a shipment from a manufacturer and through the supply chain is in fact a suspicious shipment that may get into the wrong hands and be diverted into inappropriate channels. To the extent that this vulnerability and blind spot exists, we continue to have downstream unintended consequences of these products. And third, while significant effort has been undertaken in regards to patient and prescription level analysis of inappropriate use and prescribing of these products, one core thing exists that we wanted to tackle. We wanted to prevent this shipment from ever occurring and getting into the wrong hands. As opposed to reacting at the end, we would like to prevent it from ever occurring at the source. So our mission and our goal was, can you use these modern capabilities in data science, artificial intelligence, and machine learning to solve this problem, to remove this blind spot, to prevent the shipments from ever going out from a manufacturer or distributor and getting into the wrong hands. These modern technologies and capabilities are very new and bring new solutions to this problem for us to address. And with that focus, our research begun. And I want to let you know two things as we get started. First, the research proved very favorable in the ability to use data science and machine learning to detect suspicious orders at the source and prevent the shipment of the materials. Second, that there's core policy changes that need to occur in order to allow these discoveries to be operationalized, to be put into practice on a daily basis, to save lives, to treat and deal with the issues that we have in our society, and remove the risk that we continue to have. So with that, I'd like to introduce and bring up Sithu in regards to the research, to provide us an overview of the research, its findings, and the work that was conducted. Sithu?
Thank you very much, Tony. So it's my great pleasure to be presenting our research today morning. But before I start, I'd like to welcome two more of our co-authors in this research project, Annie and Chen. Okay, so let me take you through the research we have done and the tool that we have produced that addresses the issue that Tony just set up. So our research was enabled by a court-ordered release of a database called ARCOS. So this database is managed by the DEA, and at the behest of HD Media, which worked all through 2019 in order to facilitate this release, we have access now to all movement or sales of prescription opioids or pain pills as a census in the United States over a 6-year period from 2006 through 2012. So what do I mean by that? We are able to track all movements of all pain pills all through the distribution channel or supply chain nationally for that 6-year period. So let me give you a little bit more perspective. So here is the distribution channel arrangement for prescription opioids. So as you can see, the product moves as you go left to right on the slide from a manufacturer to a distributor to a retailer to the pain patient. So that is the distribution channel structure. Now you also see the physician prescriber represented on this slide. So all of this happens thanks to a prescription that is written for an opioid drug by a physician. So therefore, the prescriber is an important participant in this supply chain as well. Now what ARCOS database spans are all movements from the manufacturers to the distributors. So look at that first link on this slide, as well as all movements from distributors to retailers, or more generally, retail customers. So that's what ARCO's data are. So it's a census of all movements at those two links of this distribution channel. What it is not is what happens at retail. So what we do not observe is patients actually buying prescription drugs at retail. That doesn't come within the scope of ARCO's data. So therefore, our research is not subject to any concerns about violating patient privacy because we don't have patient-level data. And we don't have prescription-level data either. The physician is not part of the ARCO's database. So for that reason, there is no issue associated with observing at a patient-level prescription either. So hopefully that sets up the data that we are working with. Now let me move into what we did with this data. Now we went through a 5-step methodology in empirically analyzing this data. The first step was to ask ourselves, at what level do we really want to understand potentially suspicious behavior when it comes to opioid movements? So we said we'll keep outside scope analyzing product movements from manufacturers to distributors. So we are only looking at that part of the ARCO's database where product moves from distributor to retail customer. So in our analysis, when we say customer or buyer, we are talking about the retail customer. We are not talking about the patient themselves, as I already mentioned. So the first step, therefore, is to ask ourselves how to set up a profile of that buyer or retail customer. So if you look at the right part of this slide, that tells you, in essence, what data we are mining using our machine learning technology. The left side just alerts you to the fact that there's a lot of information we observe at the retail customer level. But we boil it down, as shown on the right-hand side, to transactions. So for each retail customer, we look at the longitude of all transactions that they were involved in terms of all the orders they placed for opioids over that 6-year period. So for each customer, we know what is called their DEA registrant ID. And we also know their physical address, the name of the retailer, their geographic location, and so on. But what turns out to be of most value to us in the analysis, as will be made clear soon, is the actual longitude of transactions, not so much who they are as what they do or behavior. So the second thing we did in our methodology was to ask ourselves how to analyze or even carve out the definition of a transaction. So for that, we first took stock of how many unique opioids are there. And when I say opioids, we can start at the level of an opioid product, or what we call a stock keeping unit. And we have a total of 9,372 opioid products in the ARCO's database. That's how many disparate products can actually treat pain in the country. But then if you looked at what's inside that opioid product, you realize there is something called an API, an active pharmaceutical ingredient. And APIs are combined in order to construct these opioid products. So viewed that way, 9,372 opioid products are nothing more than different combinations of 170 APIs. And if you look one level even farther down, these APIs themselves are varying combinations of drugs or drug compounds. And there are only 14 of such compounds to go around. So our analysis is at the level of that compound. So there are 14 drug compounds or drug products, some of whom are listed on this slide. I'll mention two things: hydrocodone, oxycodone, fentanyl, and morphine. These are the four largest among those 14 drug products. They account for 84% share of all movement in the country. Doesn't mean we limit our analysis only to those four. We are going to look at all of them. But that is a curious fact. In fact, if you looked at those 9,000 or so drug products and looked at the top 50, or let's say top 100 in terms of sales, a good number of them are hydrocodone and oxycodone in roughly the same percentages as shown here. So then the third thing we did was to facilitate an apples-to-apples comparison. If somebody buys hydrocodone versus somebody else buys oxycodone, we need to put them on a comparable units footing in terms of how much product is being bought. So for that, we used the standardized unit called MME, which stands for morphine milligrams equivalent. We used a specific formula that the DEA recognizes and is commonly known in order to take how much quantity is bought and translate it to this standardized unit. So then all we care about in a transaction is how many MMEs, how many morphine equivalents is a retailer buying at a given point of time. So that is the granularity at which we perform the analysis. Then step 4. We are asking if we are building a system which is designed to catch suspicious activity, we need to define suspicious activity. So for that, we went to the DEA website and looked at all publicly published information on convictions, which retail buyers during that 6-year period were convicted for fraud, for dubious purchases. So these serve as the basis for our trying to understand how to spot suspicious behavior. So we located 188 such suspects. Now the ARCOS database itself has upwards of 277,000 retail customers across the country. So the 188 who have been convicted, we were able to match in the database using their DEA IDs. And they represent a so-called needle in a haystack. In a sea of customers, we know a small group that we know have been convicted for fraud. So then, from the remaining customers, we randomly sampled 50,000 so that we have a comparison group to the customers who have been convicted of fraud. And these buyers we called legitimate. It's fair to assume most buyers are that. So our analysis is now predicated on comparing what's different about these 188 convicted buyers compared to the 50,000 so-called comparison legitimate buyers. So we did some exploratory analysis first. And here is what we found. If we compare the legitimate buyer pool to the convicted buyer pool, we are comparing something like 65 million transactions in the first pool to about 170,000 transactions in the second pool. Two things leapt at us in that exploratory analysis. On the one hand, legitimate buyers behave very differently from the convicted buyers. I'll tell you in what sense. And on the other hand, legitimate buyers are more similar to each other than convicted buyers are to each other. So these are the two things that leapt at us initially. Clearly, there is a difference in terms of buying patterns. And two, there is more heterogeneity among the suspicious buyers. So what did we do with that? Well, we quantified the statement I just made in a variety of ways. I'm showing three here on this slide. So the first graphic says, if you look at the morphine equivalents that are being bought per transaction, the red bar tells you how much a suspicious buyer buys versus the green tells you how much a legitimate buyer buys. And that difference speaks for itself. About a 2,000% difference in terms of how much is being bought. Well, one explanation for that could be maybe these suspicious buyers just buy with longer inter-purchase times. Maybe that's why their transactions involve such high volume buying. So we corrected for that and said on a per day basis, how much are they buying? That's the second graphic. What does that show you? If anything, the difference is even more exaggerated. So if anything, the inter-purchase times are going the opposite of what we hypothesized in trying to rationalize the first graphic. And then we did it another way. Maybe these suspicious buyers just happen to be in geographies where there are more pain patients. So we accounted for that. We accounted for population density, particularly density of the elderly who ostensibly need pain medicines. The difference never went away. So clearly there are differences, striking differences. So that took us to the actual analysis. So we adopted a machine learning approach to now carefully pinpoint or build a predictive technology that would let the DEA or law enforcement be able to tell in real time how can we spot suspicious activity. So using various variants of this morphine milligram equivalent core variable, we constructed 40 input variables. All of them speak to various aspects of that longitudinal transactional behavior of a customer. And then we said we'll throw these 40 input variables into an algorithm called an anomaly detector, which will then let us spot what's different about suspicious activity. So I have bucketed these 40 variables into some broad categories. So just to give you a sense of what kind of variables we are talking about. Some of them are as shown in the previous slide. How much MME is being bought on a per day basis, on a per pain patient basis, and so on. Some of them have to do with how many unique opioid products is a retail customer buying across the 6 years. Is it 50? Is it 500? Some of them have to do with the number of distributors from which they are sourcing the product. Are they sourcing just from 2 or from 20? So that gives you the landscape of variables that we used in our algorithm. Now remember, I said we have 2 pools of customers. We have these 188 convicted retail customers, and then we have these 50,000 randomly sampled customers from the general pool. So now we separated those 50,000 into 2 groups of 25,000 each, completely at random. Why did we do that? So that when we train our algorithm, when we build our algorithm, which is designed to predict what separates a convicted or potentially convictable retail customer from a legitimate customer, we need to vindicate the algorithm, how good it is, on data that's sitting separately on its own, what we call a validation or a test set. So that is the spirit of this separation. So that top circle is what we call the training set, and that bottom circle is what we call the validation or the test set. I don't want to get into the nitty-gritty of this, but this is common practice in machine learning, which we rely on for anomaly detection as well. And then we built our algorithm. So our algorithm is a proprietary algorithm. We relied on algorithms in the machine learning literature, but at the end of the day, we had to tune those algorithms to produce something that's uniquely our own. So I'll call it a disjunctive Gaussian algorithm. I just named it. And we compared this algorithm to at least 5 popular algorithms in the computer science literature. Again, without getting into the details, I can tell you our algorithm outperformed all of those. Let me present 2 statistics to tell you what our algorithm does in terms of its ability to predict suspicious activity. There are two common measures of accuracy used in algorithms like this, or when we try to advertise what it's capable of. The first, called precision, which is the second number you see on this slide, addresses that question. If the algorithm catches a buyer as suspicious, how likely is it to be correct? So if a retail buyer is actually diverting opioids on the street, and the algorithm says suspicious, how likely is the algorithm to be correct? 100%. That's the precision we got with our algorithm. Seems a little unbelievable, but then let me qualify this with the second measure of accuracy, which asks a similar question but somewhat in reverse. It says, if the retail buyer is in fact a diverter, how likely will the algorithm be to catch that buyer as a diverter? And that measure of accuracy is not as remarkable. It's only about half as large. It's 51%. Do you see the difference? To reiterate, precision is asking if the algorithm says red flag, what are the odds the flag is in fact correct? 100%. The second question is, if the buyer is in fact a diverter, what are the odds the algorithm will catch the buyer? 51%. Slightly better than a coin toss. So why that asymmetry? Because in machine learning, there is a natural trade-off we make between false positives and false negatives. And in American jurisprudence, we always err on the side of caution. We say, if an algorithm is going to pick somebody up as a potentially bad buyer, the algorithm better be right. So we tune the algorithm to minimize false positives, which is why we have very high precision, but commensurately low recall. But we are delighted with the quality of our model accuracy, because the accuracy yielded by all these comparison algorithms were far lower than what you see here. So the proof of concept is in. So we are really excited to kind of continue to take this algorithm both to policy as well as future research. But I'll leave this here, and I'll welcome Michael to come up and then share where the study is going on the policy and implications front. Thank you.
Thank you. Thank you, Seethu, and good morning, everyone. It's great to be here with you. So, as Seethu detailed in his overview of our research, we've been able to build a predictive model that has the potential to create significant new value and impact for those working to solve for the opioid epidemic. But as Tony detailed at the start of our discussion this morning, we want to actually ensure that it can. And there are specific steps that we need to ensure are taken. And one of those steps, just one of those steps, is making sure that we affix that model to a suite of tools that will empower these stakeholders to create more positive outcomes. And while empowering these stakeholders with a new set of capabilities is most certainly an important first step, we can't stop there. These tools must also have the functionality needed to allow those stakeholders, or enable those stakeholders, if you will, to harness the power of those capabilities. And we also must ensure that that functionality is easy to use. So to simplify the point, whatever tools that we provide these stakeholders cannot make their jobs more complex. It must make their jobs easier. Now, the great news is that these tools exist. And so we thought a great example to help align all of us today on what we mean by that, we would pick a technology we can all relate to. That technology, of course, being email. In this example specifically, we're going to zoom in on Google's Gmail, which is utilized by over 1.5 billion people around the world. Now, when you think about it, we receive a lot of email. Email from the people we know, the companies we purchase from, the services that we utilize. And if it weren't for the capabilities of Gmail, it would be more likely that important information would slip through the cracks. And it would also make it more difficult for us to get to the information that we seek in any moment in time quickly. So if you look at this example here, what I'm showing you is a screenshot of Google's Gmail inbox. The capabilities of this tool are able to identify the type of sender and automatically organize those emails for you to ensure those two things are enabled. And because we are familiar with email, we're also likely familiar with the spam folder. Why? Well, because we tell our email provider to send emails there via its functionality. But what you may not realize, especially for those utilizing Gmail, is that it is powered by a predictive model, which is able to pinpoint suspicious emails. A predictive model that says, hey, this email is actually sent by a bad actor. Someone intends to do you harm. So we're going to take that email and we're going to put it in your spam folder on your behalf. And we are going to give you a clear signal, as you can see in that red icon in the screenshot, letting you know that this email is different than the other emails that you sent to spam. And even if I were to choose to click into that email out of curiosity, let's say, it gives me various cues, signals, letting me know to proceed with caution, and also gives me additional context as to why it is there. Now, this predictive model is very similar to what Sithu just detailed a moment ago, in that the vast majority of emails that are sent to these 1.5 billion people are good. We might find some to be annoying or irrelevant, but they're not intended to do us harm. So this predictive model, too, is trying to find those needles in a haystack within a vast amount of email transactions, if you will. Now, these types of tools are becoming increasingly ubiquitous within organizations across most all industries. So an example that we also can relate to, unfortunately, are text messages such as this we might receive from our bank or our credit card institution letting us know, hey, there's been a suspicious transaction on your account and we would like for you to take action. This is a problem that not only puts our personal well-being at risk, it is also projected to cost that industry nearly $500 billion over the next 10 years. But what you may not realize is that there are real people utilizing tools powered by predictive models to try and prevent these transactions from occurring in the first place. They provide these stakeholders with anticipatory intelligence to help them identify suspicious behavior and then stop it before that fraudulent transaction takes place. Another example that we may not be able to relate to as much unless we tend to forget to arrive to our doctor's appointment are hospital systems. These hospital systems use predictive models within a suite of tools, in this example, to help them understand the likelihood that a patient won't arrive to their doctor's appointment. This is a problem that, of course, puts patient well-being at risk, but also costs the industry $150 billion a year. So what it enables stakeholders to do within this hospital system is prioritize their resources to the areas that need the most attention. They're able to take manual steps to ensure those patients make it to those appointments, and they even rely on automation to send alerts, notifications letting us know, hey, you have an appointment. Would you please confirm? Here are details to directions and forms of transportation. So now that we have this contextual clarity, we want to kind of jump into the specific ways that tools like this can help those working to combat diversion. So there are three main points that I hope that you took away out of our analogous examples. The first point, alerts to take action. Although this by nature is reactive, it enables us to react quickly. The second, the intelligence that we need to anticipate to prevent bad actions from occurring in the first place. The final key point from those analogous examples, the insights that we need to prioritize. So let's jump into a couple of examples utilizing real technology that can be implemented today on how a stakeholder might use such tools. So what you're looking at here is a mock-up, but a mock-up that was created utilizing real technology. So imagine, if you will, you are in charge of preventing diversion. The first thing you do when you wake up in the morning is you open up your laptop and you go to this dashboard. And this dashboard is designed to alert you to what is happening. Think about my Gmail example that automatically organized my emails on my behalf. So as you see in the upper left-hand corner, it automatically categorizes retail buyers based on their behavior. In red, we have those that have a high deviation from the norm. In yellow, those with moderate deviation. And of course, as Situ mentioned in his overview of our research, the vast majority of retail buyers that are in fact behaving in a way that we would expect them to be. These stakeholders could even get a scatter plot of where these buyers are located geographically. Zoom in on specific geographies down to the zip code level and gain more information. On the bottom, you can see a rank-ordered list of buyers based on their suspicion level, similar to what we saw with our patient example. In the upper right-hand corner, are we seeing trends related to diversion related by the type of buyer? Something that Annie will speak to in just a moment. And then finally, in the bottom right-hand corner, a critical point, especially one that we can all relate to if we've ever worked in a tool that utilizes a database. Our ability to search for information. Think searching for your emails. Sort and filter based on questions we have in the moment. So we created a visualization of what this looks like, or utilized a visualization, I should say, of what this looks like. And this is referred to as what's called unlimited filtering, or nearly limitless filtering, where stakeholders can quickly get answers to whatever question they need answered and do it in an instant. They can then export that data and utilize that data to drive action. So this is an overview of what it might look like as it relates to what is happening. But one of the things that we've learned throughout this process is the importance of understanding why it's happening. So sometimes there are good reasons why, sometimes there are not. So in this example, I actually have the ability to click into a buyer profile. I can look to see what they are doing, alerting me of the information that's most critical. In that first upper left-hand corner, you can see the key metrics that we've identified as being most critical to understanding which behavior is in fact suspicious. As I work my way to the right, I have various charts that I can utilize to help me understand trends over time. And the Commission is going to be talking in a moment about the importance of real-time data. So being able to see over time how this change in behavior has occurred. Has it been a rapid change? Has it been a slow, incremental change? And of course, that search and sort functionality that I mentioned before. So as excited as we are about this model, we are more excited about the potential that this model has unlocked for stakeholders who are dedicating their lives to combat this issue. But what's even more exciting is there's more potential. There is current research that's being done that will enrich these tools and empower policymakers to drive change for good. So to help us understand what that current research looks like, I would like to invite my research partner, our research partner and colleague Annie Shih up to the stage to walk you through current efforts. Annie?
Thank you. Okay. Thank you, Michael. And as Michael mentioned, with more data, we'll be able to enhance the capabilities of our model. So I'm going to talk about the 3 aspects that we're going to do in our future work to enhance our model. So the first one is that we are going to allow customized detection for different types of buyers. And the second one is that we will also allow for suspicious transaction level detection. And the third one is that we will account for additional local market factors by incorporating more detailed demographic and competitive information in our modeling. So I'm going to explain each of the three aspects in detail in the following slides. Okay. So since different buyers act differently, so it is expected that different buyers may divert differently too. So for example, a diverted chain pharmacy may act differently than a diverted retail pharmacy, probably because that a chain pharmacy has more restrictions on ordering compared to a retail pharmacy. And similarly, a diverted retail pharmacy may also act differently than a diverted practitioner. Again, a practitioner may have more freedom to order from different types of distributors to avoid suspicion compared to a chain pharmacy, right? So of course, these are all conjectures and have not been backed up by data analysis yet. But we do hope to shed light on these issues once we look at these types individually. So specifically, we are going to look at chain pharmacy, retail pharmacies, practitioners, hospitals, and clinics, and mid-level practitioners, such as physician assistants. So these 5 types accounts for 97% of all buyers in our data set. And we do think that being able to allow for such customized detection, our detection scheme will be more refined and more accurate. And the second one is that we're going to allow for suspicious transaction level detection. So our current model uses the full transaction history of a buyer to detect if a buyer is suspicious or not. And we can make a richer model by detecting if a transaction is suspicious or not. So to do so, we're going to use classical economics of model of demand to model buyers' behaviors. So the model will predict legitimate purchasing behaviors of a buyer. Then based on that prediction, we will be able to judge if a transaction is supposed to happen or not. For example, if DEA receives a new transaction request, then our model will be able to predict if that transaction is supposed to happen or not. If it is predicted to be suspicious, then the DEA will be able to hold off that shipment until further actions are taken, which is going to be very helpful for the DEA. And lastly, we are going to account for additional local market factors by incorporating more detailed demographic competitive intensity information at the level of the buyer's census tract. So our current model considers population and population that are 65 and older at the county level. So it assumes that population and those population that are 65 years old and above are uniformly distributed within the same county, which might not be most accurate assumption because some neighborhoods may have more residents compared to a different neighborhood within the same county, right? So in order to correct for that, or make the prediction better, we are going to account for the population and the elderly population at the census tract level. So by modeling it at the buyer's census tract level, we will be able to better predict the demand for opioids at the market that the retail buyer is serving. And in addition to those population, we're also going to account for median household income, education level, and unemployment rate at the census tract level. And additionally, we are also going to account for information such as hospitals and hospice beds to better understand the demand for opioids. And lastly, we're going to consider competitive intensity information, such as the number of chain pharmacies, retail pharmacies, and practitioners in the same census tract that the retail buyer is located at. Now, accounting for those competitive intensity information is very important because, for example, if there are many pharmacies in one neighborhood, then a particular pharmacy may not have as much demand compared to a different pharmacy in a different neighborhood where there is no other competitors. And of course, we're still trying to incorporate the crime statistics and other opioid-related data points, such as the drug overdose burden index created by Kentucky Injury Prevention and Research Center at the University of Kentucky. And we do think that all of these statistics are going to be very helpful for us to understand the demand for opioids. And that concludes my presentation on our future research direction. So now I would like to introduce Tony back to the stage to discuss the potential policy application of the research. Thank you.
Thank you so much, Annie. And thank you, research team, for those incredible breakthrough research findings and results. I would like to thank you for all the work you've done in commitment to the research to uncover the suspicious order patterns and be able to provide a real tool that could be implemented to affect change on a regular basis. So thank you. The research findings hold tremendous promise. But to be able to fulfill the promise of the capabilities that were discovered to detect suspicious order, there requires a change. Changes in policy and considerations for change in policy. So at this time, I would like to invite our distinguished commission to come up to stage for a discussion of the policy considerations. The recommendations entail different categories of change and consideration to allow the breakthrough research and capabilities to be fully realized in action. What I'd like to do is now focus in on a few areas and have the Commission speak to those areas. And I'll start off first with Dr. Anne Marie Dale. Dr. Dale, one of the key recommendations was the need for a pilot to be conducted to be able to understand the potential applications and operationalizing it. Can you tell us a little bit about why that's such an important next step in Commission recommendation?
Sure, Tony. So first of all, I commend the research team for the wonderful job they've done. They used very sound methodology. They use very conservative decisions. They tuned their model in a way that provided these very robust results. But going forward, this model can only be improved, so it'll never get worse. The challenge, though, is the data they had available only went through 2012. And of course, a lot of things have changed in our society, even prior to COVID. But not notwithstanding, it seems reasonable that much of what they discovered will still be valid going forward once they are able to look at the future data, the data from 2013 on. But they do need to run a pilot to verify that the model that they've created will hold true, will be as robust. Furthermore, Annie just outlined a number of additional market factors which are very critical. You know, when you think about specific populations in different parts of the country, we know there are certain populations that need and utilize opioids more. Of course, for cancer treatments, of course, for other medical conditions, and of course, for the elderly. And as we look at different county levels where those problems are going to be more prevalent, it's logical that there would be a need for greater opioid purchases. So fine-tuning the model, verifying the model using more recent data is critical going forward.
Excellent. Thank you so much, Dr. Dale. Gina, one of the things that was very significantly stressed and one of the underpinnings of this work being able to be achieved was the ARCOS database. And the Commission made recommendations around the modernization of the ARCOS technology. We were well aware that the ARCOS database was never intended to be a real-time technology. Its purpose was quite different. Can you share with us the importance of being able to modernize the ARCOS technology infrastructure so that we could drive to a more real-time detection of suspicious orders? And also the recommendation for annual release of ARCOS data to be able to further and revalidate the findings with more current.
This is a very important point, Tony. What you've seen in the presentation from the research team and the points Michael made is you actually need to make these intelligence tools actionable. In order for the tools to be applied and the intelligence being sent to the DEA investigators, you want this to be executed near real time. It doesn't mean every millisecond, of course, but this needs to apply to data that's updated at least daily or even more frequently. The ARCOS database, to your point, wasn't built for this purpose. It was built as a reporting tool, which means it's retrospective in nature. When you look at the law requirements around reporting, the distributors have to report all of their sales on a monthly or quarterly basis. There is a time frame by which the reports come in. They come in electronically as well as on paper, and that actually elongates the time frames that are required to enter the data from the paper reports, and it increases the likelihood of data entry errors and other types of challenges. So this creates a practical gap between using the great intelligence tools that the team has created and the actual data infrastructure that underlies the process. And in order for this pilot that Ann was describing to actually be executed, you need the data to be updated, at least daily, and that will require significant changes to the technology. The other aspect of it, as you've alluded to, Tony, is machine learning tools are as good as the data that feeds them on a continuous basis. And what we have is a challenge of, as Ann highlighted, using data that's been released, but it's on a great lag, multiple years of lag. The data releases required at least annually would enable the continued refresh of the tools, as Ann described. Ideally, the data releases would be even more frequent, but today's laws restrict the access to the data to DEA only. So research partners or distributor partners that could aid in the process would need access to the data with at least an annual cycle.
Excellent, thank you. Building on the comments Gina made, Van, one of the things that the Commission report focused in on was a series of elements relative to law enforcement. So first, the focus on sharing data across federal agencies with anti-diversion policies or law enforcement efforts. Second, the change for a requirement of electronic reporting by all DEA registrants. As Gina mentioned, some are still not all fully implemented in electronic submission. And then fundamentally a recommendation to solicit comments from the law enforcement and compliance components on response guidance for what to do with the suspicious flags. Van, can you give us a sense, given your background and the Commission findings, why this is essential to realize its full promise?
Thanks, Tony. I'm in my 18th year at the Office of Drug Control Policy after 24 years in law enforcement, and laser focused on this opioid epidemic for well over a decade. As the research team went through their presentation, I just got a sick feeling in my stomach that, my God, if we'd have had this 10 years ago, how many lives could we have saved? Well, when distributors were sending ridiculous shipments of opioids to little towns in West Virginia and Kentucky and Tennessee, that anybody that looked at the data would know this is not right. There is precedence, though, for what we've got here. So I think back 2005, 2006, 2007 in Kentucky, we had a huge problem with methamphetamine labs. People in motel rooms, in their cars, in homes, creating methamphetamine with toxic fumes, the risk of explosion. Well, we focused in as policymakers on pseudoephedrine, the key ingredient that they would need to do that. And we worked with a company called Apris in Kentucky that created something called MethCheck. And we were the first state to acquire this product and require all pharmacies to report electronically into this system. It's now all across the country. But going back to 2007, we were the first state to do that. And what that did, we passed a law along with that electronic system, so you can only buy this much. You can only buy so many grams of pseudoephedrine in a year's time. And the system kind of kept track of that. It would flag the pharmacist to say, oh, they're trying to buy more than they should. We don't have any meth labs anymore. That's not to say we don't have methamphetamine in this country. We all know we have a tremendous amount of it being shipped across this country by the cartels. But the problem of exploding meth labs, of renting a hotel room that just had somebody cooking meth in it before you checked into it, all that danger is gone. And it's all because of the technology. We changed behavior by using that technology. That was 2007. Now what can we do with the technology that the research team has laid out? 2012, we passed a major piece of legislation in Kentucky, did a lot of firsts. Became the first state to require prescribers to check their prescription drug monitoring program before prescribing an opioid. Our Board of Medical Licensure went beyond that and said before prescribing any controlled substance. But to what your question, Tony, what we realized in 2012, we had the Board of Medical Licensure that investigated, and the Board of Nursing and the Dentistry Board. We had the Kentucky State Police that had investigations going. We had the Attorney General's office that had investigations going. Guess what? None of them ever talked to each other. So we created a system where they had to, when they opened an investigation on a prescriber or a pharmacy, they had to put that information into the system where everybody else could see it. So now, by going in and checking the system every day, as a Board of Medical Licensure, I can see, oh, KSP's got a case working against this prescriber. And then we required them to meet every so often to go over what's in the database and where their investigations were. That's the same thing we're talking about here, about sharing data. There's more than one agency that's involved in these investigations. They should be talking to each other. I mean, my God, we learned that with 9/11. We got to talk. Our agencies have to talk to each other. But so far in the drug space, we've not done that. And I'll leave it there.
Excellent. Thank you, Van. Thank you so much, and thanks for the background on how we've addressed it in other areas. Very powerful. Well, these new technologies and new capabilities mean a change in competence and skill sets. They're very complex, as you saw through the presentations, both through Michael as well as Annie. These are modern tools, very different than the tool sets and capabilities we've had in the past. So with that comes a great need for change in our competencies. And Mary, the Commission spoke about two very important areas. One recommendation, programs and efforts to ensure DEA has expertise in artificial intelligence, data science, statistical analysis, and modeling of the ARCOS database. And then secondly, fund registration, upgrades, and maintenance of the ARCOS infrastructure funding, and recruiting and talent development to be able to leverage that database to the fullest, as provided in the example here with the research. Can you share a little about this area of the Commission's recommendation for talent development and funding needs to help the technology discovered realize its full promise in execution in our society?
Thank you, Tony. It's always great to follow my friend Van. We've been in these trenches for quite a long time together, but the Commission did realize that we can't come out with these great ideas and opportunities and sort of bring the technology to where it needs to be today without saying we need to, first of all, fund it. So we're hoping, of course, that the Congress funds something like this and recognizes, like Van is saying, this is taking what used to be anecdotal. It seemed the street cop knew before anybody else knew where the problems were, but it was sort of a lacking communication to the Congress and maybe to the DEA. I don't know that. But so recognizing that we have this technology, and I think we saw a great example with using Gmail on how this works, but recognizing the DEA might already have the talent in-house and they might not. We don't know that, but we do believe that they should make sure that there are capabilities within the DEA for people who can do this data analysis, read the spreadsheets, and then apply the data. And I think that one thing we kicked around a lot too was real time, how much does real time matter to law enforcement? So I think that we found the sweet spot on that. Of course, this data, it's as good as the data is when it's going in, and as good as the data is as applied going out. And I can tell you this from my congressional hearings, even when Van testified us, eons ago, we were very frustrated. We were very frustrated that we didn't have this capability. I think that we felt that capability existed in other areas in commerce, but not specifically to the pharmaceutical supply chain. And then lastly, I'll just say, Tony, that I'm encouraged by this. I think that this sort of technology, it ensures integrity within the supply chain. It ensures that we can dissuade the bad actors, if you will, or the people who want to divert drugs. But it will still allow people who truly need their pain pills or pain medications to get them. And, Van and I worked together on the Collaborative for Effective Prescription Opioid Policies, and our whole goal is to find the key balance where patients get the medicine they need, but the medicine is kept out of the hands of people who don't need it. So long-winded answer, Tony, to that, but I'm excited. Like Van is saying, I wish we had had this a decade ago. I believe had we, then we probably would have saved countless lives by now if we did have this technology. So did I answer your question?
You most certainly did. You most certainly did. So thank you, Mary. And, you bring up a good point, one that it's going to take a multi-stakeholder approach. In many of these situations, it was unwitting where manufacturers would be responding to what they felt was a need by patients to obtain legitimate medicines, and unwittingly contributing to shipments that would be diverted through the channel of which they were blind to, right? And that's the premise of being able to detect those in advance before the shipment goes. And so it's going to take a collaboration. Darryl, one of the recommendations that the commission made was to build new partnerships between industry and government. We've mentioned DEA, but they're one of the key stakeholders. Obviously, the industry and the supply chain is another critical stakeholder in a collaboration between the two. And then the second recommendation along this line was reporting to Congress on the ARCOS data, evaluations of the efficacy of artificial intelligence use and machine learning use to drive solutions across the supply chain, both governmentally and industry. Given your extensive experience in governance and running the practice at Brookings Institution in this area, can you share some light as to both the importance of this, possibly even some exemplars of it, and for the critical aspect of this being a change factor?
Well, thank you, Tony, and congratulations to the research team for coming up with great products and a great analysis here. On the congressional reporting side, as Mary suggested, reports to Congress actually are very important because legislators obviously can appropriate money to support these types of activities. There may be policy changes or regulatory changes that need to be approved, and so informing them of what is going on in as real time as possible is really important. A lot of congressional reports actually drive press coverage, and so it's also a way to educate the general public, the research community, people in industry, and so the reporting requirement we think is an important supplement to all the other recommendations that have been made. And then Tony, as you suggested, it's important for every product to fine-tune the product, to do assessments. So in a lot of areas at Brookings, we support pilot projects combined with policy analysis and policy evaluation, just to see how the AI is performing, how the machine learning is performing, how the data analytics is performing. Like, is it yielding the kind of results that you need to really guide the actions that you want to take place in this area? And then the last point I'll make is on this industry-government partnership, which you mentioned. That is absolutely crucial because industry has the data. That's where these activities are taking place. They do the manufacturing, they do the distribution. But the government role is important in the sense that they have both the policy, the legal, and the regulatory apparatus. And so getting them to work together, kind of ending the siloing that Van was talking about, which has been very problematic over the last decade or so, that is really important. And so
These types of public-private partnerships really can be very valuable in driving positive change for the future.
Thank you, Daryl, and thank you to the Commission for all your countless hours in reviewing the research and understanding how the research could be put into real practice and the barriers for it to fulfill its promise. For obviously more detailed, many of you have links and the QR code to be able to get to the full Commission report. We've highlighted just several of the key areas for recommendation. And at this time, then, I'd like to invite the research team back up to entertain and take in questions from both the audience here with us as well as online. So, research. Great. And let's see, we have one right here. Yep. Yeah, we'll get a mic to you.
Good morning. Thank you. My name is Andrew Kessler. I work here in Washington, D.C. solely on substance use disorder policy, and I'm proud to say Washington University class of 1993. So the first thing I want to say before I ask my question is, I don't know if you were aware of this, the acronym ARCOS, A-R-C-O, in the world of SUD, substance use disorder treatment, also stands for Association of Recovery Community Organizations. So please be careful when you're talking policy and using that acronym ARCOS that we don't confuse the two. But my question is, as much of a problem as this remains in the United States, we're also seeing the abuse of fentanyl and fentanyl analogs. And a lot of the overdoses that are being caused, especially in areas like California or the Southwest that are closer to Mexico, are being caused not necessarily by fentanyl that is produced legitimately, but by fentanyl analogs. So as more of the black market moves towards fentanyl analogs, how do you see your tools possibly being adapted or adjusting to changes in the ingredients or the drug of choice by either dealers or consumers?
Yeah, great. Sithu, can you speak to that?
Yeah, that's an excellent question, which we have had discussions about. Unfortunately, we are not ready to give a really good answer to this yet. The world has changed a lot. Anne-Marie mentioned this, Gina did, about our data span 6 to 12. So on the one hand, 10 years have elapsed. And two, the kind of problem that was topical at that time is not necessarily the problem we contend with now. Right? At that time, oxycodone was the big thing in prescription opioids. Right now, it's fentanyl. And then you are raising this issue of illicit fentanyl, street fentanyl. Of course, our analysis is all on so-called legal purchases and so on. So I can only speculate as to, how to extend this. But in principle, if there are ways of accessing good proxies for what is happening on the street, on the one hand, we can exploit that to make better predictions on the legal prescription opioid purchase front itself, and then use the proxy data to separately model what's happening on the street. Right? But for that, the first step is to even know how to access that data as to what is happening by way of illicit shipment, buying, and so on. We have products coming in from overseas, right, which is fueling that. So absolutely, it's very important. As a society, we have to be alert to that. Maybe we have solved one problem, and in the process, we have moved the problem in another direction, right? This is like the old prohibition thing. Prohibition created, problems of different kinds. So therefore, yes, we have to be alert. But let's solve one problem at a time, and then.
But I will add, I think that's where Annie's research in particular really This is where Annie's research that she detailed at the end of our presentation really comes into focus. So the University of Kentucky's creation of the Opioid Burden Index is a great example of that. Other data that we've discussed is Narcan revivals. So any data that we can layer on top of this tool to help understand where help is needed and even use our model to rule out certain behaviors, enables stakeholders to focus on other paths that are leading to those negative outcomes.
And can I just add that I think this is an example of what AI can offer. You know, the utilization of data and mining that data in order to answer some of these very challenging questions that might look quite different in terms of how you create that model, but the methodology that C2 and his team used is applicable to other systems. It would be quite different, but so I think the technology and the methodology is really robust, and that's what would potentially be used for that future problem. But I agree with you. It is a real challenge.
Excellent.
Maybe this is a great dissertation problem for Annie. As so-called PI, we don't use that term in the business school. Maybe I've taken a disproportionate attention on myself, but she's the engine behind all of this research.
Good morning. Thanks so much. Great presentation. I really enjoyed it. I have a question that's maybe a little bit more on the philosophical side, but this is one of the first great examples that I've seen of the interaction of AI and actually action by government. We can talk about probable cause if you're talking about the criminal side, or just on broad ways then of use of civil cost. But nonetheless, it would be the basis for action, right? I think with recall and validity in this model, that's very little of a concern here. But in a broader sense, as more of these tools start being used in the government, what safeguards, if any, need to be implemented so we don't have a situation with an overzealous prosecutor or something like that? Because this actually has effects also, like on some of the distributors, for example, pulling a DA license or something like that stops the entire business. So there's the risk also on the other side of the patient not getting the things that they need. So is this something that you have been thinking about, and are there any recommendations?
You know, it's interesting. In the states, we have prescription drug monitoring programs. And we can look at the data and say, oh, the prescribing in that county just went up 15%. We might take a look at that and find an oncologist opened up a practice there, and he's treating pain patients. So yes, you have to be, you can't make it. We talked to the commission, we talked about this a lot. And Tony and Sithu alluded to, we'd rather be wrong some of the time and miss some than create these actions where they're not needed. And I think that's the beauty of their model. 100% accuracy? I don't know of anything like that. But yeah, we talked about that a lot over the last year. And we've done that at the state level is don't jump to a conclusion, jump to this needs a closer look. And oftentimes we get a complaint on a physician and do a peer review, and the prescribing is completely appropriate. Yeah. So that happens a lot, but you never hear about those. Those don't make the press.
And I can add just a quick footnote to what Van said. We actually have been working with federal agencies to encourage them to use more AI and machine learning and data analytics, just because that's all taking place in the private sector. Government agencies need to use this to fulfill their mission as well. But you're right, there are risks of AI. There are risks in terms of possible biases, lack of transparency, the possible impact on human safety. So what we recommend to them is they need to also start hiring ethicists and social scientists and people who can think about the ethical and philosophical ramifications of moving to this type of thing. We want to become proactive and anticipate what the possible problems are before we're actually using it, the problems pop up, and then we're having to run to catch up and deal with those issues.
Any others on the commission want to speak?
If I can pile on, I think one of the largest risks of using these types of tools is the quality of the underlying information. We talked about the timeliness. Data that's not timely is going to lead to ineffective follow-up. So all the enforcement things that need to happen require timely data. On top of it, needs to be accurate. And I think you made a great point earlier, Dale, on the need for collaboration, because a lot of data resides outside the government systems. And Van, you've talked about the lack of that collaboration, bringing the data together so it's timely, it's clean, it's accurate, and it feeds the predictive tools with good information that actually will yield the best precision possible. So it's a huge component, it's costly, and that's why Mary hit on the funding piece of this in her comments. And if that doesn't happen, you run the risk of having great models not producing as accurate a result because of the information feeding into them.
And I'll add on behalf of the Commission when we discuss this that the tool is one that can enable and inform actions. And so much as we think that you saw the data set, there was a small pool in that data set that were contributing to it. And in many cases, there's engagement by agencies because of the unwitting diversion by different entities. And so to your point about prosecution, et cetera, the process by which it would inform conversations, evaluation before jumping to those type of conclusions. Yeah. Any other questions here? We do have a question online for the research team. The first is, how long did it take to do the research to develop this capability? Sithu?
I will let my bright side of this research collaboration answer that. Chen, maybe you can go first, then Annie.
Yeah, can you hear me? Okay. So I think Sithu and Annie first started on this project around May, and then I came on the team in August, and we had just kind of finished cleaning the data, filling in missing values, because there are a ton of missing values in the data set. And so starting from August up until I would say around December, January was when we were, fine-tuning the model, trying to increase our accuracy, trying to make sure that we were still hitting solid, close to 100 or 100% precision, while upping our recall, trying to see how many of the bad buyers we could accurately predict while keeping our precision level at the 100%. So, half a year yet.
Well, I think for me, it's almost a year, because I think, yes, we got the data, and then the ARCOS data is large, is 80 gigabytes. Oh, at least for me, it's large. So then it takes a long time to actually understand the data, and then because we also need to have the labeled buyers, right? Those convicted buyers. And those buyers actually takes a long time because, yes, it's posted online. So then I will have to go through every single document to read everything and why it is convicted, when it's convicted, and for what reason. And then also have to match them back to the ARCOS data. So I think data cleaning takes a long time. And then, but after that, it's a lot. It's just very smooth, I think.
Tony, I can remember being on a call with Sithu and Annie and asking her, do you do anything else other than this? It moved really fast when you consider everything that was involved.
And the complexity speaks to why the need, and thankful to the Bellwether Foundation for being able to support this research, which took quite a long time to make sure it was strong, accurate, and rigorous in its capability. We have one more question online that we'll take, and it relates to the fact that the ARCOS database has more controlled substances than just opioids, and over 100 of them. And the question, Sithu, Michael, Annie, and team is it applicable to all the other products that are within the tracking of the ARCOS database for DEA?
Well, the ARCOS database do span things beyond opioids, but the data we have access to, by court order, what has been released is only opioids. But if the question is, in principle, would a similar model apply? I'm not so sure, because in other categories, if you don't have activity of this kind going on, at least the model we have developed is to detect anomalies, right? So unless there is an anomaly aspect to some other category, I don't think the model would apply. But could we predict, buyer behavior in other categories of medication? Sure, yeah. I mean, in fact, the current approach, the extension that Annie presented, is relying on traditional economic models of demand. I mean, how can we explain how a buyer buys given inventory considerations and other things? And how do we take that model as a starting point to, as a side benefit, also detect anomalies? So that approach can do more than just detect anomalies. We can shed some light on what drives buyer behavior in general.
Yeah, one of the controlled substances that shows up most often with opioids and an overdose death is benzodiazepines. and that the combination of those two drugs can be very deadly. So that's something I hope that the research team will be able to look at in the future and start looking at how, when those drugs are prescribed in combination, what the issues can be.
And
I would suspect when you look at high opioid prescribers, you'll find high benzo prescribers and retailers as well.
And I think it's worth noting quickly that what we highlighted is when you have the data, when you leverage processes such as the one that C2 detailed with the technology that's available today, we can work to solve those types of challenges. So is it possible? Yes, it just depends on what data we have, but we're showing that with the methodology and the talent and the technology needed, you can work to use data to solve those complex challenges. And I think that's the main takeaway.
Excellent. Well, I want to thank the Commission and the research team for such tremendous work in battling and tackling this opioid challenge that we have in our society. I want to just summarize in regards to our work and the mission of the Commission. First, we have validated that data science, artificial intelligence, and modern machine learning tools can in fact be a powerful tool to tackle this problem. That the methodology proved and resulted in a very valid model for detecting suspicious orders and the ability to prevent orders from being released at the point of manufacture before they ever get into the supply chain and get diverted and cause harm. Secondly, we found from a Commission policy recommendation that work needs to be done to facilitate the full promise of what's been developed by this research team. Policies around data sharing, around modernizing the architecture and technology, underpinning the collection. And third, the development of talent and competencies in the different agencies to allow for these type of findings to be discovered. And last but not least, this will take a multi-stakeholder approach. This will require industry and government to collaborate to make the breakthroughs. And what we're hopeful as a commission is the discovery we made from a machine learning will be the basis by which the two major stakeholders, as well as all the non-governmental NGOs who work feverishly day by day to address this issue, that our discovery can be the basis for collaboration and new programs and new effective tools to put an end to this crisis. I want to thank you all for attending. I want to thank again the Commission and all their hours and the research team. I'd like to invite Dean Taylor for closing remarks.
Thank you. Well, what an extraordinary presentation. What an opportunity to make a really positive impact on this terrible epidemic that has affected so many in our community, in our national, international community. So thank you, Tony, Seethu, all of the Commission members, the entire research team from the Centre for Analytics and Business Insights, and of course, thank you to the Bellwether Foundation for your generous support of this project. If you used one phrase to describe Olin Business School, it would be that we are values-based, data-driven, and that runs through everything we do in the school. And there is no finer example today of being values-based and data-driven in the research and the policy recommendations that have been developed here. So this is really emblematic of what WashU Olin Business School represents. We are dedicated to applying the rigorous use of data and the careful consideration of our principles to go beyond the bottom line, to address and impact critical issues in society. And we're really truly privileged also to partner with Brookings as we work to influence policy for the greater good. I want to finally remind you that the full Commission report is available to you to download at the Olin Commission website. It's also available in the handout you received this event today, or it's been posted in the chat for our virtual audience. And I encourage you, if you haven't got one, if you're here, please see one of our colleagues to get one before you leave. So now it's time to see what we can do about putting some of these recommendations into action. Meanwhile, I should tell you we're already working to put together our next Olin Brookings Commission project, and more to come on that soon. So thank you for being with us today, and good afternoon. Fantastic. Excellent. Yeah, first rate. Well done.